Hello, my name is Carly Miller. I'm going to be teaching you about tracheostomy care. What I'm going to start with first is just explaining to the patient what I'm going to be doing. So what I'm going to be doing first, Mr. Rodriguez, is I'm going to be suctioning your trach. I'm going to be getting the secretions out, okay? Do you understand? And then afterwards, I'm going to be changing the dressing on your trach, okay? Okay, so the patient is already in a semi-Fowler's position. We've already gotten that fixed. I've raised the bed to a safe and comfortable height, and I'm now going to place my towel on the patient's chest. Okay, now let's see. I've got all my appropriate supplies near. I'm going to go ahead and wash my hands. And then I'm going to put on a face shield. I'm going to go ahead and connect my suction tube to the actual suction and then keep the end of that I need near me. I'm going to go ahead and put an oxygen mask delivery system on the patient and hyperoxygenate them before we do this. I'm going to go ahead and maintain my sterile technique and fill the sterile basin with 100 milliliters of normal saline. Okay. And then we're going to suction a little bit of the saline out of the basin just to make sure it's suctioning good. Okay, perfect. It's suctioning good. Sorry, I feel like this needs to be. Okay. Go ahead and put this little drape on you, okay? There we go. Then we're going to go ahead and going to don your sterile gloves. Keeping this sterile. Okay. Oh. We are going to remove the oxygen delivery system. Here, all of this area is staying sterile. All right. I'm going to gently and quickly insert this into his airway until I meet resistance, and then I'm going to come back 1 centimeter and apply intermittent suction. So, I'm going to quickly and gently, you may feel a little bit of discomfort, I'm just putting it in, okay? Okay, I feel resistance, I'm going to come back 1 centimeter, and as I'm twisting, spinning it, I'm going to do intermittent suction. Okay. I'm now going to replace the oxygen delivery system. I'm going to rinse this out with the normal saline until it runs clear. Okay. I'm going to put this around my hand. I'm going to take this glove off with this inside. So it's in just like that. I'm going to discard of all of this, and I'm going to go ahead and put the oxygen back on the normal level that he was on before. So now that I have finished all that, I can take the face shield off. I'll now do hand hygiene. I'm going to record the amount of secretions that I got back, consistency, odor, how the patient responded to it, and I'm going to record their cardiopulmonary status before and after suction in my notes. So now we're going to talk about cleaning the inner cannula and changing the ties. So I'm going to go ahead and do hand washing, and I'm going to put my gloves on. So basically the patient is having a chance to go ahead and restore their oxygen levels from the suctioning that we just did while we get all of our cleaning stuff ready, getting everything opened up. He's kind of getting a break and getting his oxygen levels back to where they need to be. So I'm going to go ahead and remove the soiled dressing. Just removing the dressing. Okay. So now I'm going to don sterile glove on my left hand, my non-dominant hand. So I'm going to go ahead and don that. So I have sterile glove on this hand. And I'm going to use that hand to, to place all of these on the sterile field. So we're going to say I just took this sterile thing out of here. I only had one, so I had to kind of double use it. But we're going to say we just took this out of there. And I am going to take all of these sterile things out and place them on that. So now I'm going to fill one of the basins ½ inch full with normal saline and the other ½ inch full with hydrogen peroxide. Okay, now I'm going to do 2 4x4s are going to be left dry. And then 1 is going to be put in normal saline. And 1 is going to be put in the hydrogen peroxide. All right, perfect. Now I'm going to go ahead and put the sterile glove on my dominant hand. Okay, so both of these. So I'm going to take my cotton tip swabs. I'm going to put 1 in the hydrogen peroxide and 1 in the normal saline. I'm going to have the oxygen source should be loosely placed over the area so he still needs his oxygen. So at this point, I'm going to go ahead and take the inner cannula out with my non-dominant hand. So I'm going to carefully pull out that inner cannula, and that's the part that kind of like goes in at an angle to the patient. I'm going to take that out and drop it out. We're going to go ahead, let's see. So we kind of want to be quick. I feel like I just said drop that, and I did not mean to say drop that. We want to clean it. We're going to clean the inside and outside scrubbing. You want to be quick because you want to get that back in as quick as possible. So this is what you can use to clean the inside of that. Clean the outside of it. We're going to rinse it, and then we are going to dry it well. And then we are going to replace the cannula by locking it in place. Actually, we're going to replace it with our non-dominant hand, locking it in place. All right. Now I'm going to use the hydrogen peroxide swab. Oh, something stuck. I'm going to use the hydrogen peroxide swab to clean the outside. So this is going to be for the outer cannula and the stoma. So it's going to be all of that outside area, and we're going to do it in a circular motion. So I'm going to go ahead and clean. Okay. All right. You use, I don't know if I said this out loud, you use the swab and the gauze from the hydrogen peroxide in a circular motion to clean the outer cannula. So now we're going to go ahead and use the normal saline. The normal saline gauze is kind of to rinse the hydrogen peroxide off that outer area that we just cleaned with. So this is my normal saline gauze. Are you in any pain? Are you having any discomfort? No? Okay. If you feel any discomfort during this, let me know, okay? Even if you just raise your hand. So I just use the normal saline gauze and the cotton swab. Let me get it a little better with the cotton swab so we can get underneath. So basically the hydrogen peroxide cleans it. The normal saline rinses that hydrogen peroxide off. So we're going to push the ties to the upper part of the faceplate. And this is kind of hard to show because we don't have the full thing. But we're going to put the ties to the upper part of the faceplate. We're going to put one end of the tape in the lower portion of the faceplate and then pull the ends even. So you want to try to get it as even as you can. You're going to slide both ends of the tape behind the head to either eyelet and insert one tie through the eyelet and pull until they're snug and even. So you're going to tie the ends in double knots, allowing for 2 snug finger widths. You don't want it to be too tight. You want it to be snug, but you do not want it to be too tight. Once you get that like newly put in, you're going to take out the old tie. You're going to insert the clean trach dressing under the faceplate, which is going to be kind of this one that's split. This goes under. This kind of goes as a barrier between the faceplate and their skin. So at that point, you would just make sure the patient is comfortable. You know, are you comfortable laying like this? Did you want to change positions? No? Okay, the patient is comfortable. I'm going to remove these. I'm going to remove my face shield and I'm going to discard of everything, wash my hands, and I'm going to record everything that I've done here, record any abnormalities, record the suctioning, the amount that I got from it. I think I already went over that with the suctioning part, but yeah, that is pretty much it.